The presentation that I'm going to share with you shares what I describe as baby steps providing meals for NCDs prevention in Ghana. And by meals, we are not providing meals as in meals, but meals as in measurement, evaluation, accountability, and then leadership support for NCDs prevention in Ghana. The efforts benefit significantly from three related projects and some small studies that we have done either individually or in groups. So the dietary transitions in Ghanaian cities project, the dietary transitions in African cities project, and currently what we are implementing now, which is the Meals for NCDs project. By way of background, Ghana, just like other African countries, is experiencing a rise in prevalence of obesity and nutrition-related non-communicable diseases. A comprehensive assessment that was done a couple of years ago of Africa, but also of other continents by the Institute of Health Metrics and Evaluation, University of Washington, noted that Ghana had recorded more than a 500% increase in adult obesity prevalence over a 30-year period. Indeed, if we look at our local data from the Demographic and Health Survey, there's a similar trajectory where overweight and obesity among Ghanaian women as of 1993 was just about 9%. In 2014, this increased to 40%, similar to what the other study found. Also, over 40% of adult deaths in Ghana currently are attributable to non-communicable diseases. And so these tidal wave of obesity and non-communicable diseases, especially nutrition-related non-communicable diseases, others have observed is a consequence of market failure, government failure, and also food system failures. And such failures, you would agree with me, require decisive and effective response. Unfortunately, we do not have simple solutions available to address this. These are complex problems. And so that is why there's the need for food environment or food system-wise approaches. So of many approaches that could be adopted, we are currently implementing those relating to the informers. I wouldn't take your time to talk about informers because it will be introduced to the participants soon. Except to say, our implementation of the informers approaches has entailed engagement with different stakeholders. We have engaged individuals, we have engaged communities, we have engaged local stakeholders, and also national stakeholders. One of such engagement was the Ghana Food EPI exercise, which assessed the extent to which Ghanaian governments implemented recommended policies to sanitize or improve our food environment. As part of that process, the objective was also to identify gaps, but also suggest solutions to address those gaps. And so I show you here, when we went through that long process, deliberative process with government and non-government stakeholders, they came out with these top priorities, that the Ghanaian government to come out with legislation to control marketing of unhealthy food and beverages, that there should be policies that seek to ensure that healthy foods are affordable, that government should also provide support relating to nutrition labeling, as well as improving the currently being implemented school feeding program. Apart from this, we have done other studies. So for example, we looked at the healthiness of food and non-alcoholic beverages marketed on popular Ghanaian television channels. One of such studies recorded nearly 2,000 adverts, and of these 2,000, about 600 were of food. And 1/4 of these foods that were advertised were actually sugar-sweetened beverages. All of us know the implications of consumption of such food on our health. We moved to our shopping malls and assessed the healthiness of food that were on promotional flyers of fast food outlets. And unsurprisingly, this is what we found. We found 100% of all the foods that were on the promotional flyers to be unhealthy, 100%. We went to our university campuses, and one of such studies looked at commercial food advertising on the campus of University of Ghana. And here we observed about 500 adverts, 50% were of food, and of the food adverts, 60% were unhealthy. Of these, there were 4 out of 10 being, again, sugar-sweetened beverages. Our team also investigated food and beverages that were sold or advertised in our communities. And here we found as high as 40% again being sugar-sweetened beverages. One other thing we noted was also that in addition to these unhealthy, energy-dense and nutrient-poor food, we also found typical of most Ghanaian food, energy-dense, but also nutrient-rich food. And so these data, the evidence that we generated then led to the birth of Meals for NCD project. So I thought it would be good to give participants this background. The current focus of the Meals for NCD, as we have indicated already, is restricting unhealthy food marketing to children and also improving our school nutrition environment, motivated by the recommendations from the previous work. Currently, we have mobilized stakeholders from government ministries, departments, and agencies, UN agencies, civil society organizations, international experts, and even lawmakers. And with this mobilization and engagement, we are very convinced that there's a conducive environment in Ghana to not only implement just these 2 models, but others relating to regulatory, legislative, and even fiscal measures. All these we have done wouldn't have been possible without this dedicated team you are seeing here. In the interest of time, I wouldn't be able to mention their names, but the brochure of the meeting that we have shared has profiled all of them. Thank you, Meals for NCD investigators. The Meals for NCD project also receives support from International Project Advisory Board that is chaired by Professor Mary Laar of University of Toronto and other members from Ghana. So Mary from National Development Planning Commission, we have civil society organizations as members, as I noted earlier, Ministry of Health is represented, WHO is part of the advisory committee, Food and Drugs Authority, UNICEF, IFRI, as you can see here, and also a Ghanaian member of parliament. All these people are providing support to Meals for NCD. And of course, our very capable and dedicated, highly motivated early career researchers who are at the forefront of the implementation of the Meals for NCD. The Meals for NCD project also supports students, and you can see here we have 2 doctoral students who are affiliated to the Meals for NCD and 2 master's students currently. So I thank you very much, and I will yield now to the moderators, Professor Ayite.